Hi everyone, I'm Nadia Farrell Peanut, Head of the Adult Education Division.
Hi, my name is Miss Roach. I'm the Minister Secretary for Ministry of Governance.
Hi, I'm Consuelo Warrington, Administrative Assistant at the Establishment Personnel and Training Department.
Hi, I'm Shamin Thomas from the Ministry of Governance.
Hi, I'm Bruna John Baptiste, Senior Clerk, Establishment Personnel and Training Department.
Hi, I'm Emmeline Augustine, Establishment. Just wanted to know that
I got vaccinated.
I got vaxxed.
I got vaccinated. I got vaccinated.
I got vaccinated.
I got vaxxed.
And I encourage you to get vaccinated.
Take the vaccine. Take the vaccine. Need it.
I think this is definitely the way so we can make it, so things can go back to normal, you know?
I feel that getting vaccinated is something that's necessary for us to go back to normal like how things were before, and I'm excited to be like one of the first people to get a new vaccine.
I'm a little nervous, but kind of excited at the same time.
I'm here to take my Covid-19 vaccine.
How do you feel about that?
I'm a little nervous, but I'm excited because I don't like injection.
I don't want to get COVID, so I'm really happy to take the vaccine. And I want everybody else to take the vaccine because it's very important. Get vaccinated.
Good evening, ladies and gentlemen. We welcome the listening and viewing public, Dominicans here, and those of you in the diaspora who so diligently tune in to these COVID-19 updates. We thank you for joining us this evening. We have as presenters this evening Dr. Shaluddin Ahmed, who is the National Epidemiologist, and also Dr. Kivian Burnett, the National Coordinator of the COVID-19 Vaccination Unit. And with our statistics, we welcome Dr. Ahmed.
Thank you, Ms. I acknowledge presence of Dr. Barnett, media, viewers or listeners. Good evening to all. COVID-19 status update as at December 2nd, 2021. Total number of new cases, 38. 34 of them are antigen positive and 4 are PCR positive. Total number of active cases, 396. Total recovered cases, 5,613. Total COVID-associated deaths now stands at 40. Vaccine coverage, our vaccine coverage is 54.2% of the target population who took at least one dose of the vaccine, and we have 50.4% of the target population are now fully vaccinated. Our daily trends, daily trend of COVID-19 cases from July 28 to December 2nd is up and down. But in terms of weekly average, as you can see, is stable at 41. As of last week, it was 41. Demography and severity of the new cases. As you can see, distribution of new cases by age and sex. I want to point it out, the age group, 12 and 17. Since we introduced our vaccine for this age group, the number of cases remain very low for this age group. Most of the cases are coming between the age of 18 and 65 years old. In terms of their clinical presentation, 50% are mild, presenting with mild symptom, and 47% are asymptomatic. they were diagnosed through normal screening process, and 3% symptomatic with severe symptoms require hospitalization. Demography of active cases of COVID care complex. Those who are at the COVID care complex as of December 2nd, 2021. Total number of cases as of December 2nd, 2021 includes 235 cases. The proportion of cases, 56% are female at the COVID care complex and 44% are male. Number of cases at the COVID care by age group. Most of these cases are 18 to 59 years age group. There are almost close to 78 cases are under 18 years age group. We also have about 38 cases from 60 and over years age group. In terms of their severity, 51% are mild, 44% are presenting with a moderate symptom, and 5% are severe who require oxygen therapy. Our positivity rate up and down, but as of yesterday, it stands at 6%. That means we are getting 6 positive cases out of 100 tests were conducted. COVID-associated deaths, total number, should be updated as of December 2nd, 2021, not November 25th, 40 of them, 18 males and 22 females. Their age range from 40 years to 107 years. Their median age 80 years. Comorbid condition, most had underlying medical condition, about 97.5%. And vaccination status, 38 out of 40 were unvaccinated. In summary, number of daily cases are stable. Most of the deaths are unvaccinated, over 95%. And since introduction of vaccine for the age group 12 to 17 years age group, we are seeing less number of COVID-19 cases. Some upgrade on Omicron is a new variant. We already learned that. It is now detected in 38 countries, including 3 in the United States, in California, New York, and Minnesota. Its severity is still under studies. Study is still ongoing. The preliminary evidence suggests that it has increased risk of reinfection. With this in mind, our public health measures remain the same. Let's get vaccinated. Let's continue to wear our face mask. Let's avoid social gatherings. Let's keep 6 feet distance, anyone other than your household members. Let's frequently wash and sanitize our hands. And I thank you for your attention.
And our thanks to Dr. Ahmed, the national epidemiologist. Again, for those of you who may have missed it, new cases 38, active cases at 396, our recovered cases 5,613, COVID-related deaths at 40 here in Dominica. The ages range from 40 years old to 107. As Dr. Ahmed mentioned, one of the public health and safety measures, or one of the ways that we're asking that you assist in this fight against COVID-19 is to get vaccinated. And with us this evening, we have the National Coordinator of the COVID-19 Vaccination Unit, Dr. Kivian Burnett.
Thank you, Ms. Harry. I would like to acknowledge the presence of my colleague, Dr. Shaluddin Ahmed, the national epidemiologist in Dominica. This evening, my presentation will be more of a teaching to the general public as to how we combat the fight against COVID-19 and where vaccines are needed. The Commonwealth of Dominica continues to grapple with the impact of the COVID-19 pandemic. Since the onset of the current wave, dominated by the Delta variant, the virus has reached a point of widespread transmission across the country. It continues to be the longest standing and most severe wave, straining the healthcare system due to unnecessary deaths and cases rising daily. The socio-economic impact of the virus also shows an effect across the island. Schools have to be resorted to virtual learning. Businesses have to either be closed or scaled down. And the psychological toll on the human resources is unimaginable. In response to this pandemic, the world saw the rapid development of vaccines against COVID-19 as an extraordinary achievement. However, many persons continue to be vaccine hesitant and continue to spread misinformation regarding the effectiveness of the vaccines. The National COVID-19 Vaccination Unit, has since then embarked on a public education campaign to increase public confidence in uptake of the COVID-19 vaccines, while reinforcing the safety and health and safety protocols implemented by the Ministry of Health, Wellness, and New Health Investment. Okay, so a lot of persons are claiming that COVID-19 is a new virus, but a lot of persons cannot remember in 2003 we had the SARS pandemic. Now, SARS is a sister to COVID-19. SARS comes from the name Severe Acute Respiratory Distress Syndrome, okay? And the one in 2003 actually originated from Wuhan, China. Well, not Wuhan, but in China. Okay, and this was noted in 2003. Now we have the novel COVID-19 pandemic, or the novel COVID-19 virus, which is originated from China as well. Now both of these viruses are considered COVID-19 or coronaviruses because it belongs to a group of RNA vaccines, or RNA viruses, sorry, that are predominantly noted in birds and mammals. Now, how does COVID-19 differ from SARS? COVID-19 and SARS are similar in many ways, but here are different examples as to the similarities by both. They are all respiratory illnesses caused by coronavirus. Coronavirus gets its name from the crown-like projection that is noted on the outer surface of the cell. It's transmitted by respiratory droplets, which is produced when a person with the virus coughs or sneezes, or by contact with an object or surface containing the virus. It has a similar stability in the air on various surfaces, as we just mentioned. It can lead to potentially serious illnesses, sometimes requiring oxygen or mechanical ventilation. Can have worsening symptoms later on in the illness, and have a similar at-risk group, such as the elderly, and those with underlying conditions, as well as those who are exposed directly to the said virus. The signs and symptoms of that of COVID-19 and that of SARS. We have common symptoms like fever, cough, fatigue, shortness of breath, muscle aches and pains, headache, diarrhea. But that of COVID-19 now is something that we have noticed it is very constant, which is loss of smell and taste. You also have chills, sore throat, runny or stuffy nose. Now, SARS-CoV-2, which is COVID-19, appears to be more transmitted or transmitted easier than that of SARS-CoV-1. This is because the viral load appears to be higher in the nose and throat of persons with COVID-19 shortly after symptoms develop. Now, a lot of persons, when you talk to them, they talk about immunity. Now, this is a pictorial definition or graph that shows the different types of immunity. So in general, we have what we call acquired immunity. Acquired immunity can be divided into two types of immunity, which we have active and passive. Now, you look here towards the left, you have natural immunity. From the active immunity, natural, and you have artificial. So immunity is defined as the body's ability to protect itself from an infectious disease. On our daily traversing throughout the island for inoculation of vaccines, a lot of persons are claiming that they rather get natural immunity than that of artificial immunity. Now, the WHO has stated on numerous occasions that herd immunity against COVID-19 should not be achieved by exposing persons to COVID-19, which will result in unnecessary cases and deaths, right? A vaccine uses a weaker or a dead form of the virus or a disease to stimulate an immune response. Vaccines, as we know, are typically injected or administered in the intramuscular areas, which is your arm, which we may call as medical persons your deltoid. Also, it could be nasal or it could be a spray, and even under your tongue for children getting polio vaccines as well. When a person's immune system detects the weakened or dead pathogen, it begins to make the steps to destroy that pathogen. This includes the formation of new antibodies and memory cells specific to that pathogen. So in the future, if the body is exposed to said pathogen again, antibodies will be created to protect the body. Vaccinations and immunity are essential for keeping large populations of persons safe from infectious disease, especially that of COVID-19. These are the 3 vaccines offered in Dominica, which was approved by the WHO for emergency use listing. We have the Oxford AstraZeneca vaccine, which requires 2 doses for one to be considered fully vaccinated. It is given at 8 weeks apart. Persons who are eligible for these vaccines are persons 18 and over. Then we have the Sinopharm vaccine that is created and was distributed by the People's Republic of China. It's 2 doses that's required for one to be fully vaccinated at 3 weeks apart. And now recently we have the Pfizer BioNTech vaccine, which was recently approved by the FDA and is suitable for children 12 and over. This vaccine requires 2 doses at 3 weeks apart. So a lot of persons may come and say they want a vaccine, but they have no recollection as to which vaccine they took, and by the discretion of the nurse or the healthcare provider, the weeks apart that the person said that they took the vaccine is how we may identify which vaccine that the person took. But we are encouraging persons, once you get vaccinated, you are given an appointment card, which you have to present to your next health center or the same health center that you went to get your vaccine, so that you can make sure that we have adequate and proper information in regards to vaccine uptake among our public, or population, sorry. Next, we're gonna look at different myth busters that we get on every day when persons are asking questions in regards to vaccines. So this one said, will getting the COVID-19 vaccine cause me to test positive on a viral test? Now, viral test just means what we are doing now, which is an antigen test. It's a rapid test. It's sensitive for COVID-19, but it's not specific, okay? So no, none of the authorized and recommended COVID-19 vaccines cause you to have a positive test or an antigen test, or positive results, sorry, on an antigen test, which are used to see if you're currently or actively infected. If you are to have a positive test from receiving a COVID-19 vaccine, that will be on an antibody test. The antibodies indicate that you were previously exposed to the virus or recovering from the virus, hence the reason you have antibodies. This one is a very popular one we get among females as well as males. Question about fertility regarding the vaccines. Now, is it safe for me to get a COVID-19 vaccine if I would like to have a baby one day? Of course, yes, it's safe. The COVID-19 vaccines are recommended for everyone eligible, and we like to make sure that we tell you about the age range, because Pfizer vaccines are approved for children 12 and over, and as Dr. Ahmed has indicated earlier in his little presentation, that since we have started inoculating children 12 and over, we have seen a decrease in the number of cases among the youth, especially those 12 to 17. So once you're eligible to receive a vaccine, be it the Sinopharm, the Pfizer, or the AstraZeneca, you can get your vaccine and it would not have any implications on you getting pregnant one day, as well as men with erectile dysfunction problems and fertility problems. And very soon we are going to have vaccines being given or offered at Dr. Ferrara's office. As we should all know, Dr. Ferrara is an obstetrician gynecologist, very versed in that field in terms of women's health care and child health care as well. So questions can be posed to him, and inoculation can also be happening at the office on the days that he is agreeing to have inoculation happening on that day. Okay? Number. A very nice myth buster, and again, these are the things that people say on a common basis or daily basis as to regards to the COVID-19 vaccines. So can the COVID-19 vaccine make me sick with COVID-19? And the answer to that is no. None of the authorized COVID-19 vaccines contain the live virus that causes COVID-19. I should repeat it again. Can a COVID-19 vaccine make me sick with COVID-19? And the answer is no. None of the authorized COVID-19 vaccines contain the live virus that causes COVID-19. Okay? So this means that the COVID-19 vaccines cannot make you sick with COVID-19. However, we are saying, or we have known from knowledge from since the beginning of vaccines, that you may get what we call an immune response to the vaccine, which may lead to fever. That means that your body is fighting that said infection to build antibodies and memory cells. And this is a normal sign for any type of vaccine that you take, just to build resistance and antibodies to the COVID-19 virus. Last but not least, do the COVID-19 vaccines contain microchips? This is a big no. The COVID-19 vaccines does not contain any microchips. The vaccines are developed to fight against the disease and are not administered to track your movements. If you want someone to track your movements, think about your cell phone in this regard. None of the vaccines contains eggs, latex, or any preservatives. All COVID-19 vaccines are free from metals such as zinc, cobalt, lithium, or any other rare earth metals that you may encounter in your daily reading, okay? And with this being said, I hope some clarity was brought to the general public in regards to the COVID-19 vaccine. Now, with this credible information brought to you this evening, the onus is on you to make the decision to get vaccinated. At this point, I'd also like to thank the healthcare workers at each of the 7 health districts in Dominica that is fighting against this COVID-19 pandemic in our country by either taking care of sick patients or inoculating the general public with COVID-19 vaccines that would help decrease the spread and also new emerging variants in our country. Before I leave, I would just like to plead with the general public that the persons involved in vaccination are not to be abused verbally or physically when on our daily traversing throughout the country. So please, if you're not interested in getting vaccinated, just say yes, ma'am, no, ma'am. I would not like to get vaccinated. Please go along. It's not necessary that persons are being threatened with cutlasses and stones and verbally abused. It's not worth it, just to help our population or some form of normalcy happening again. Parents, you have seen from the data that inoculation of the COVID-19 vaccines help the children in terms of getting cases and not getting sick. Also, it provides opportunities for your said child to maybe get a scholarship to go to study on a sport merit or whatever the case may be. So think about it in that way, as well as schools reopening, so some form of normalcy can happen again. Once again, thank you. A pleasant evening.
And I'd like to thank Dr. Burnett for his presentation this evening, and also thank him and the entire vaccination unit for your continued efforts. It's tireless, it's thankless, but we appreciate what you've been doing to make vaccination more accessible to the general public. We know that the vaccines on wheels so far, that's been pretty successful. So your contribution in this fight does not go unnoticed, Dr. Burnett and your vaccination unit. Thank you so much. Ladies and gentlemen, the festive season is ramping up. We're almost at Christmas. So that means now is the time to be even more cautious with your movements and in your preventative measures. We ask again that you continue to adhere to the protocols. Wearing of masks in public, that remains mandatory. We understand it's not the easiest of things to do. However, when you think of the alternative, it's an easy choice. Physical distance remains important. We ask that you continue to wash hands or sanitize hands if soap and water not available. Do what it takes to protect yourself and your family. Vaccination, of course, is another vital option. We thank you for your time and attention. We ask that you remain safe this weekend. Have a good evening.
Hi everyone, I'm Nadia Farrell Peanut, Head of the Adult Education Division.
Hi, my name is Miss Roch. I'm the Minister Secretary for Ministry of Governance.
Hi, I'm Consider Warrington, Administrative Assistant at the Establishment Personnel and Training Department.
Hi, I'm Shamin Thomas from the Ministry of Governance.
Hi, I'm Verna John Baptiste, Senior Clerk, Establishment Personnel and Training Department.
Hi, I'm Emmeline Augustine, Establishment. Just wanted to know that
I got vaccinated.
I got vaxxed.
I got vaccinated. I got vaccinated.
I got vaccinated.
I got vaxxed.
And I encourage you to get vaccinated.
Take the vaccine. Take the vaccine. Need it.
I think this is definitely the way so we can make it, so things can go back to normal, you know?
I feel that getting vaccinated is something that's necessary for us to go back to normal like how things were before, and I'm excited to be like one of the first people to get a new vaccine.
I'm a little nervous, but kind of excited at the same time.
I'm going to take my COVID-19 vaccine.
How do you feel about that?
I'm a little nervous, but I'm excited because I don't know I can catch it.
I don't want to get COVID, so I'm really happy to take the vaccine. And I want everybody else to take the vaccine because it's very important.